All right, everybody, let's work on a quick active range of motion screen that we can do at the bedside while your patient is sitting edge of bed, or if they're already up in a chair or you position them in the chair beforehand. This is a great screen that you can do to see how their body is working together. We will be going over both the upper and the lower extremity. So let's start with the upper extremity. So first and foremost, before you do anything, you want to make sure that your patient's feet are secured on the ground, or if you need to add a step underneath for them, you can do so. That way their feet aren't dangling and they're having to really activate their core just to hold themselves up. So we want them to be nice and stable. Also, if they do have difficulty with trunk control, make sure that you're able to provide that assistance as needed to help with their balance and to keep them safe. All right, let's get started. So to get started, we'll have you shrug your shoulders up, bring them back down. Great job. Let's lift your arms up, overhead, back down. Now let's bring your arms out to the side like we're gonna do snow angels. Back down. Great job. Let's reach behind your head like you're gonna wash your hair. Now behind your lower back like you're gonna pull up your pants. Great job. Can you bring your arms out straight in front of you? Let's touch your shoulders. Bring them down to your side, about 90 degrees. Good job. Now let's have your palms up like you're gonna hold a cup of soup. Now let's bring them down. All right, good job. Now let's see how your wrists are doing. Can you lift them up, pointing your fingers to the sky? Now let's point them down to the ground. Can you make a full fist? Good job. Can you open your fingers all the way? Good job. Now let's touch each finger to your thumb. All right, great job. Now let's talk about what each of those were. So we had our shoulders up and down, so that was our scapular elevation and depression. We brought our arms up overhead for our shoulder flexion, bringing it back down to neutral. If you wanted to and had the space, you could have them reach further back for extension if their seating surface allowed for so. Bringing their arms out to the side in the snow angels for shoulder abduction, back down to neutral for adduction. We did our internal and external rotation, adding combined movements. So when we brought our hands behind our head, we had our external rotation. Then we brought them down, acting like we were going to pull up our pants. That was our internal rotation. The good thing about this movement is it does have a little bit of shoulder extension in there, so you can assess that when you're doing this motion as well if your patient's not able to reach back. All right, we had the arm straight out. Then we transitioned into flexion of the elbow. That was extension. When we had our elbows at the side, because we're assessing the forearm, we're doing supination of the forearm for palms up, pronations, palm down. All right, then we brought our wrist up for wrist extension, down for wrist flexion. We made a full fist to make sure our composite grasp is doing good. And then we brought our digits out for full extension and abduction. All right, then we did our finger opposition, making sure the fingers are coordinated, working together, and to see how their coordination is, the speed is of those movements, and how fluid it is. All right, let's move on to the lower extremity. So same as before, make sure the feet are nice and secure on the ground and your patient is stable. All right, let's bring your knee up like you're gonna do a high march. Great job. Let's do the other side. Great job. Now let's kick your knee out like you're gonna kick a ball and bring it in underneath you. Kick that ball out and bring your knee underneath you. Good job. All right, now let's bring your leg out to the side, back in, out to the side, back in. Now I want you to have your outer ankle. Let's bring it up towards the sky. Bring that outer ankle up to the sky. Now I want to have you bring your left leg out of the way to the side like we did earlier. Now let's bring your inner ankle up to the sky like the heel is going to touch your leg, and then do that on the other side. Bring that inside ankle up to the sky. Another thing you can do is have the heel slide up your shin, up your leg. Heel slide up. Good job. Now let's lift your feet up so that your toes point to the sky. Good job. Toes point to the sky. Good job. Now let's hit that gas pedal. Hit that gas pedal. Good job. Now let's have your outer ankle hit to try to touch the ground. Good job. Outer ankle to try to touch the ground. Now let's have your inner ankle try to touch the ground and your big toe. Inner ankle try to touch the ground and your big toe. Good job. Now let's talk through what these were. So we had our hip flexion. We brought it back down to neutral. In the sitting position, you cannot test the extension of the hip. You could try that in alternative positions in standing or lying down in the bed, but we are able to do the hip flexion. So then we brought our leg out to the side. We were looking at hip abduction, and then we brought it back in for adduction, bringing it back to neutral. We kicked our leg out for knee extension and underneath us in for flexion. We did our internal external rotation of the hip. So when the ankle was coming up, the outer ankle up to the sky, this was our internal rotation. Think about the movement of the hip. And then when we brought it, our shin, our heel to our shin, that was our external rotation. So think about the motion of the hip. It can be a little bit tricky if you're looking at the foot position, but think about how it's kind of going the opposite direction. All right, so then we did our toes up for dorsiflexion and down for plantar flexion. We brought our outer ankle to the ground for our eversion and inner ankle to the ground for our inversion. All right, and I think that's it to cover the upper and lower extremity for a quick screen. That's a great thing to do in acute care or even a skilled nursing setting whenever you're needing to do a quick overview to see how your patients are moving. And then after you do that screen, if it's indicated, you can move on to manual muscle testing and other assessments as needed. All right, great job, everybody.